Okay, welcome back to today's webinar on laser therapy for lymphedema. It seems that everyone can see me and can hear me okay, so that's wonderful. My name is Dr. David Kunashko. I'm a chiropractor, acupuncturist. I've been practicing for about 30 years now, which seems like a long time. And my involvement in low-level laser therapy or photobiomodulation has been well over a decade now. Obviously, I work with a team here at Meditech International in the clinic, as well as a director of training and education. And of course, we manufacture and distribute Bioflex branded laser therapy devices. The idea behind these webinars is informative. So it's meant to inform practitioners about specific conditions and some of the research on laser therapy and these conditions, as well as some case studies and how you would use Bioflex laser therapy to help these conditions. So lymphedema is one that, as a chiropractor, you see it, but you don't necessarily, treat it directly. And it is a fairly common condition. Massage therapists treat it quite frequently, using lymphatic drainage techniques, that kind of thing, physiotherapists. It's such a prevalent condition that I think if you use our system and say you're a chiro or other practitioners maybe don't treat a lot of lymphedema, this is something you can educate your patients about. They may know someone or have a family member or what have you that could really benefit from low-level laser therapy and lymphedema. So I'll talk a little bit about the different types of lymphedema, as well as an overview of the lymphatic system. Of course, this will be a review for everyone. I know that, but it's good to have a review. And then I'll present some of the research, of which there's quite a bit. I was surprised when I had done a previous webinar on this topic quite a few years ago, and so this is a refresh. And there's still some really good research coming out on this topic. So I thought that was really, really great to see. And then I'll talk a bit about how you would use our equipment, some of the protocols that we have specifically for lymphedema. I have two case studies. I pulled these out of the archives directly from Dr. Fred Kahn himself, so I can speak to those as well. And then of course, we'll have some time for Q&A. Remember that these webinars are always recorded, so that if you have to leave early, or you in fact can't even listen or watch the webinar or want to rewatch it, then as long as you register for the webinar, you should receive an email, follow-up email within a few days to be able to watch it on YouTube again. If for some reason you don't get that email or that link, then let me know and I will make sure you get a copy of it. So lymph obviously is a watery fluid. It circulates throughout the lymphatic system. It's formed when interstitial fluid is collected from lymphatic capillaries. It's then transported through larger and larger lymphatic vessels, eventually to lymph nodes, where this lymph is filtered essentially by lymphocytes before it drains back into the venous system. So if you were to look at it, it's kind of similar to, if you know what blood plasma looks like, it would be similar to what blood plasma looks like. So it returns proteins and excess interstitial fluid back into the bloodstream. This stuff accumulates because capillaries are leaky. And in fact, it may actually contain some nasty things like bacteria, even viruses. And generally speaking, that's the purpose of lymph nodes, where they're destroyed lymphocytes or white blood cells, and they can help get rid of these nasty pathogens. Lymph also transports fats from the digestive system, eventually to the blood via chylomicrons, which is just a structure between the fat globules and cholesterol. So if you look at the lymphatic system, of course, as a review, it's throughout the body, including the periphery extremities, the arms and the legs, which is generally speaking what we would treat for lymphedema. Lymph nodes, of course, you have the afferent and efferent lymphatic vessels, the lymph coming in and then being filtered in the node, and then it exiting out the efferent lymphatic vessels. So lymphedema, by definition, is a swelling of one or more extremities that results from impaired flow from the lymphatic system. I have a reference a little bit later on by the Cancer Society, because a lot of lymphedema is secondary to breast cancer and surgery. And they do a great job of talking about lymphedema and so forth. So some of my referencing is actually from that website. It's really great because it does a great job of explaining things. So as a patient resource, you might want to use it, but even better, it gives you treatment options. And it does mention laser therapy, and I'll mention that a little bit later on. So when lymph vessels are blocked or unable to carry lymph fluid away from the tissues, then this can cause a backup essentially, and this will result in lymphedema. So usually lymphedema affects one arm or one leg, but it can, in certain circumstances, affect bilaterally as well. So there's two kind of types of lymphedema. One is considered primary and one is considered secondary. We tend to see more secondary, but you may also see primary in clinical practice. Primary lymphedema is an abnormality such that the lymphatic system is somehow affected right from birth, or it's a genetic or hereditary type of scenario. So congenital lymphedema, this tends to be more common in females. This is about 20% of all cases of what's called primary lymphedema. Lymphedema precox, which just means early on, is the most common form of lymphedema. And it becomes usually apparent right after birth or somewhere before the age of around 35. And the symptoms most often develop noticeably during puberty, again, much higher female to male ratio. Primary lymphedema that becomes noticeable after the age of around 35 is known as Meige disease or lymphedema tarda. This is kind of the least common form of primary lymphedema. So if you have primary lymphedema, it's usually obvious before you enter into the mid-30s years of age. Whereas secondary lymphedema, this develops when a normally functioning lymphatic system is somehow damaged or blocked or diseased. In North America, and probably in other jurisdictions, other countries as well, breast cancer surgery, this is a fairly common sequelae. So oftentimes combined with radiation treatment results in blockages and damage to the lymphatic vessels. Typically, obviously, it's one-sided, but not always, because sometimes breast cancer, for example, will be bilateral, but usually it's on one side. Surgical procedures may also damage lymph nodes and or lymph vessels, and this may also cause lymphedema. So if someone's having surgery, in the axillary region or the groin region, that may also cause lymphedema. So, things like vein stripping, burn scar excisions, peripheral vascular surgeries. There's lots of different types of surgeries, usually vascular surgery that may end up causing some damage to the lymphatic vessels. So more severe trauma, for example, car accidents, even burns, these kinds of things, severe compression, or even tumors that can apply pressure to lymph nodes and damage them as well. These are all possible mechanisms for what's referred to as secondary lymphedema. Now, if you live in tropical climates, lymphedema is extremely common by a parasitic infection, kind of like a roundworm mediated by mosquitoes. Filariasis, I'm not sure I'm pronouncing that right. This is one of the leading causes of lymphedema, and it's quite a very significant form of disability throughout countries in tropical areas. So typically countries that have not very good healthcare systems, and so parts of Asia, Africa, Western Pacific, and so forth. So these parasites can damage the lymphatic system, leading to swelling in the arms. It can be quite severe, like elephantiasis. In women, it tends to be more in the breasts and the legs, and for men, it's more in the genital and the groin region. Lymphedema as far as it being related to cancer, this generally speaking is where the lymph nodes are usually removed to prevent the spread of cancer. So usually in the upper limb, it's in the axillary region or the neck. In the lower limb, it might be the groin or the pelvis region. Of course, there's auxiliary lymph nodes in that area as well. So more than the stats I had, and this is from 2013, so it's probably a little bit higher. I do see someone that has a raised hand. I don't know if that, Doreen, if you did that on purpose or not, but whoops. I will say that just ask me the question. If you have any questions, just type them into the Q&A box, and I will definitely address those questions at the end of the webinar. So once again, type in your question, no issues at all, in the Q&A box, and I'll get to those at the very end. The stats, approximately 1 in 5 women who survive breast cancer will develop unilateral arm lymphedema. So you can imagine this is an extremely prevalent type of sequelae. There are kind of 3 stages of lymphedema that's typically referenced. The latency stage is a stage where you're not even aware, the patient's not really even aware of it, so it's not usually diagnosed. But it starts to become diagnosed when you start to notice some edema, some pitting edema, where it is essentially an edema that reduces on elevation. Then as it slowly progresses into stage 2, you no longer get reducing spontaneously of this pressure when you put it on the or push it on the skin. And this is because you have the development of protein-rich edema and fibrotic tissue. So this is now becoming quite serious and quite chronic. By the time we get into stage 3, it's and typically it doesn't get to stage 3 in North America because it's treated, but you can get elephantiasis, which is quite large areas of edema, hardening of the skin, excessive swelling, and you start to see quite progressive skin changes as well. So usually when they're coming in to see you for therapy, it would be in stage 1, approaching stage 2 is usually the scenario. So symptoms, this is, by the way, referenced from the Cancer Society pages as well. I have that reference coming up. So obviously there's swelling from the arms to legs, fingers, or toes. This is important. If you're trying to treat it with laser therapy, you want to target where the actual lymphedema is at its worst, as well as the lymph nodes. There might be a feeling of fullness or puffiness or heaviness in the arm, leg, or genital region. Sometimes a patient complains of achiness or burning in the extremity. You might noticeably see changes in the skin, like shininess. That's quite prevalent as well. Obviously, because of swelling, they might have difficulties with range of motion, whether that's shoulder or elbow or knee or what have you. The skin itself might become thickened. There might be the appearance of small blisters or growth-like warts, or sorry, growth-like, growths that look like warts. These contain clear fluid. The skin, as it advances and the skin changes into the 2nd and 3rd stages, starts puckering and may take the appearance of an orange peel. Skin that doesn't indent when pressed, for example, that's in the fibrosis stage. Obviously, they might complain that their clothes are too tight or their jewelry feels too tight. So again, if you have any questions, it's a little easier for me to navigate. Type them into the Q&A box. I will get to those even in the chat box as well, but it's just easier for me to look at one. So I'll get to those very shortly. There might even be some itchiness of their toes or legs as well. So that's in a overview. I mean, we're all pretty familiar with this, but it's kind of nice to just to have a fresh look at that. Even if you do treat lymphedema on a daily basis, it's good to review the anatomy and pathophysiology. Lots of research. I'm pulling out some of the research I thought was quite good. This particular one from a journal called BMC Cancer, published in 2017, looking at photobiomodulation. I always like to use that term, but everyone still refers to it as laser therapy. and your patients will know laser therapy, but the research now is shifting to the term photobiomodulation, if you're not familiar with that term. And that's really because it's light that is interacting with the cells. And that light can come from a laser, true, but it can also come from LEDs if they're powerful enough and they have the right wavelengths and energy density and so forth. So in this particular one, it was a systematic review, which carries a lot more weight than just a single randomized control trial. They looked at 11 clinical trials, of which of those 11, 7 were chosen for analysis, meaning that they had significantly good statistical analysis. So the results essentially showed there was very good or strong evidence that showed low-level laser therapy is more effective than sham treatment in limb circumference and volume reduction at short-term follow-up. So if you want to get the circumference down, this is a really effective way of doing it, especially in combination with other techniques like lymphatic drainage. There's quite a few other techniques. I myself am not an expert in lymphedema treatment per se, but you know, there's quite a few things out there, from compression bandages to manual therapies and so forth that are available. There's in this particular paper, they said there is moderate evidence showing that photobiomodulation was effective for helping with pain and noticeable subjective symptoms, showing that photobiomodulation was helpful as well. This particular paper looked at 9 clinical trials, again, a systematic review and meta-analysis. And they concluded that there was moderate strength evidence that supports low-level laser therapy in the management of breast cancer, specifically breast cancer-related lymphedema, with reduction in the volume of the lymphedema as well as pain. So greater reductions in volume were found with the use of laser therapy, and the implication essentially is that cancer survivors, that laser therapy can confer clinically meaningful reductions in arm volume and pain. So this is a kind of thing that if you treat lymphedema and you're not using laser therapy, really the evidence is showing you that you'd have even better results, and it would be even more helpful if you added that. That's why evidence-based guidelines are so important and to keep up to date, because when you got trained, whether that was a few years ago or 10 years ago or 20 years ago, you know, these new evidence-based therapies are being published all the time. This particular paper was a double-blinded placebo-control trial looking at post-mastectomy lymphedema. They looked at 50 women with breast cancer-related lymphedema, 25 of which received active laser therapy and 25 sham or placebo laser therapy. They used a near-infrared 904 nanometers, quite low power, 5 milliwatts, fairly small point size, 0.2 centimeters squared, and specifically are targeting the axillary lymph nodes and certain arm areas as well. The treatment was performed 3 times a week for 12 weeks. And in general, when you ask about treatment plan, that's what I'd recommend. When a patient's coming in with lymphedema, I would prefer that you treat it about 3 times a week. As you start to see fairly good results, then you can go down to twice a week, but don't rush to that. If they're responding quite well with 3 times a week, then I would leave it at that. And remember that a treatment plan for chronic lymphedema or treating these types of conditions is not a few weeks. We're talking a much longer treatment plan, and they may need ongoing treatment as well. So the primary finding in this particular paper was that laser therapy reduced the volume in the upper extremities, increased shoulder mobility, improved grip strength with post-mastectomy lymphedema. So obviously they found that it was quite beneficial for these patients. This next paper was published very recently. That's why I want to mention it. And it's a evidence-based guideline, and it was published by the International Society for Lymphology. And the previous evidence-based guideline was published in 1995. So these evidence-based guidelines get updated, sometimes 5 years, 10 years, 20 years, they don't get updated all the time. And that's why it's really important to take a look at them. So anyway, they were specifically looking at the treatment of peripheral and how to manage peripheral lymphedema. So they looked at all the different potential treatments out there, and then they looked at the evidence and then made comments about whether or not they were effective or not. Now, I'm not going to go over all of them. If you want to read it, it's free online. You can just search the ISL, International Society for Lymphology, and the consensus document. But anyway, with respect to laser therapy or low-level laser, as they mentioned it, reports with fairly, they say, small numbers and limited meta-analysis, kind of disagree with that because there's fairly robust research, but still, they're saying that it's demonstrated efficacy for patients with lymphedema. So they did notice robust changes are noted with the reduction of pain and mobility, a little bit less so than edema volume reduction, even though I was showing you some evidence earlier that it seemed to be quite effective for both. But they're saying more for pain, a little bit less for the edema, for the volume. But in my experience, you're going to see both reduced quite dramatically. The reference for the Canadian Cancer Society, if you go and take a look at that, especially with the treatment and managing side effects, you'll see that there's a notation about certain treatments available for lymphedema. And they do mention laser therapy can help lessen lymphedema and skin hardness. And it's interesting, they say a therapist especially trained in using lasers or handheld device to aim the beams at the area of lymphedema. It's kind of a simplistic view of photobiomodulation because there's a lot more to it than that, but this is meant as a general public information. So, this is where patients go to get to look to see what can they do to help their lymphedema, and they're mentioning laser therapy. So it's really important that that on your website that you mention one of the uses for laser therapy is lymphedema. Maybe have some information, maybe a link to this specific area as well. Again, just for patient education. All right, so I've been babbling on long enough. How does laser therapy help with lymphedema? It really comes down to cellular biology, and I won't go into a lot of details, but if you've been watching some of my previous webinars, you know and you understand the implications of nitric oxide. And nitric oxide is one of the key mediators of lymphatic contraction and relaxation. So this mechanism isn't 100% clearly understood, but they do feel that it's nitric oxide that modulates lymphatic vessel contraction and therefore lymphatic flow. And since we know photobiomodulation can release stores of nitric oxide, then this can subsequently improve blood flow and lymphatic flow. So it really comes down to specific enzymes in endothelial cells. Now, if you went back to my first few slides and you looked at lymph nodes and the lymphatic vessels, you will see lymphatic endothelial cells. These can secrete different enzymes, including ENOS, which is endothelial nitric oxide synthase. This is really important because this enzyme will modulate the relaxation of the lymphatic blood flow. So small amounts in a normal hemostasis and metabolism will be very helpful in releasing this nitric oxide that causes relaxation. And it's interesting that nitric oxide in small amounts is also released when you stretch or massage lymphatic vessels as well, which is why lymphatic drainage is so effective. Now, so that's why these two work really well in combination. So excessive amounts of nitric oxide produced by an enzyme called inducible nitric oxide synthase occurs when you have inflammation. So if there's inflammation going on, what happens is it becomes a much larger gradient of nitric oxide. And so because of this suppresses the eNOS. So it essentially, inflammation increases INOS, which reduces eNOS, and all of this will lead to basically a shift towards contraction as opposed to relaxation, and thus reducing lymphatic flow. You know, I can't really go into a lot of detail here, and if you're really super interested in this, you can Google it and learn a little bit more about this enzymatic activity. But the key thing is that laser therapy can help modulate eNOS in a favorable way to reduce INOS. That's the bottom line. So when you're using BioFlex equipment, one of the key things you're going to be using is this large surface array of lights that will affect all the lymphatic vessels where you're treating. You'll also use a high-powered laser probe to get deeper into the lymph nodes as well. So we have a specific protocol for this. Depending on your jurisdiction, geographical area, the equipment that you have, you may or may not have this specific protocol. So here it is. And essentially there's 3 stages. If you're not familiar with equipment, we always have 3 stages that is increasing intensity and stimulation, both dosaging and cycles per second or flashes of light. You can see it starts fairly low with infrared at 10, 20. And then as you start to get higher and higher stages, you can see a much higher frequency and duty cycles. My job right now isn't going to be to describe the differences between stage 1, 2, and 3 and all that. That's what I do in my basic certification training. If you have our equipment, you're already familiar with that. We do offer, Dr. Khan, who himself was a vascular surgeon, has treated a lot of lymphedema patients, and he in particular laid out some specific treatment tips with respect to treating lymphedema. It's all here for you, so you can review that when you have a chance to go over the webinar as well. So I encourage you to do that. When you're going to be treating lymphedema, you know, the targets are both the lymphatic vessels and the lymph nodes. So if you're treating, say, the upper extremity, you'll want to treat the lymph nodes in the axillary region and the antecubital fossa in the elbow. Now remember, if you're treating someone that is recovering from cancer, you have to make sure that that they're cancer-free. If they're still undergoing treatment and there's a possibility that there's still cancer in the nose, that kind of thing, then it's contraindicated to use laser therapy. So once they are in remission, once they're having issues with lymphedema and they're cancer-free, but they're struggling with the side effects, is the time to be using low-level laser therapy. Similarly, you know, in the groin region, you'd also want to be treating those specific areas, as well as the popliteal region. This is behind the knee, and treating the popliteal lymph nodes in that area as well. And when you're treating the lymph nodes, you'll really want to target using the laser probe as well. So in the few minutes I have left, I want to present a few case profiles. These are specifically from Dr. Fred Kahn. This was an 80-year-old male. He presented with lymphedema. Essentially, it was secondary to surgery. So this was a secondary type of lymphedema because of post-harvesting long saphenous vein. He had, obviously, it's kind of hard to tell because, you know, you can't really compare it to his good leg. But you can see that there is some cyanosis in the region that Dr. Kahn noted. There was firm, non-pitting edema and very poor venous filling. So how the treatment was approached was wrapping the array around the circumference of the affected area. So when you're treating lymphedema, these protocols, the time frame will be a little bit longer because you do have to wrap them around the extremity. Dr. Kahn did 10 one-hour sessions over about 4 weeks, so about 2 to 3 sessions per week. In that time, he also, by the way, treated the sympathetic nervous system locally. So that would have been the lumbar sacral region and the sympathetic nerves in that region as well. We oftentimes do that because by treating the nervous system that supplies the area that is affected may also be quite good. So he was able to reduce the edema. I don't have the stats here. I thought I did, but I must not have put it in. But you can see in the picture even, there was I think around 5 centimeters or so, 6 centimeters of reduction of circumference post-treatment. So, and you can also clearly see there's significantly less cyanosis as well. This particular case was a 58-year-old female with chronic lymphedema. This was also accompanied with cellulitis, so a bit of an infection as well. I don't have the history behind the reasons for the lymphedema. Initially, measuring 35 centimeter circumference on the right, the less affected side. I don't know if there's edema there or not specifically, lymphedema, but on the left side, there was significant lymphedema measuring 43 centimeters. So again, 9 one-hour sessions over 3 weeks. This patient, by the way, ended up going to see another clinic closer to where she resided. But in that time frame, and it's not the best picture, unfortunately, but the left leg mid-calf circumference after these sessions was reduced by 5 centimeters. The cellulitis that was present initially was significantly reduced. Dr. Khan noted about 80 to 90% resolved without the use of antibiotics. Okay, so upcoming events, we have some trainings coming up. If you haven't received your BioFlex certification training, please join us for a live online training. Usually it's on a Friday or a Saturday. The next few are on Saturdays, October 16th, November 20th, and December the 11th. Just go to our website to sign up. I have a webinar coming up on hand arthritis on October 21st. This one's geared a little bit more for patients that are using the BioFlex personal therapy system, but anyone can join in as well. And I have an advanced certification training course coming up in December. I'm waiting for an announcement on my guest speakers, and this is on aging, cosmetic problems. I'll also talk a bit about some skin conditions as well. So that should be really interesting, including hair growth. So, so hopefully you can join me for that as well.